And I would like to introduce the first presenter to this webinar. And I would like to present David Sherman. David Sherman is a veterinarian from the United States who has worked in veterinary education, regulatory medicine, international development. He has been with World Organization for Animal Health headquarters in Paris since 2013. Currently works in capacity building department, where he manages targeted support activities in the PVS pathway, including veterinary registration and veterinary workforce. Welcome, David.
Thank you, Simon. Hello, everybody. Welcome to the webinar. I hope it's useful and instructive to you. What I want to do is give some contextual background to the key presentation today, which will be Kelsey's presentation on the work she did on reviewing the veterinary legislation in Africa around veterinary practice. And just wanted to give you the background on what we've been doing with workforce development, how it merges with the veterinary legislative support program and the PVS pathway, and how it led to this analysis that Kelsey did that she will share with you. So again, WOA is a standard setting organization, and I want to just talk briefly about WOA standards in the veterinary workforce. And Simon already alluded to this, the fact that the workforce is an essential element for a well-functioning veterinary service. And in the Terrestrial Animal Health Code, which is one of our two standard setting volumes, the other being Aquatic Animal Health Code, Section 3 is on the quality of veterinary services, and Chapter of the code focuses on the importance of evaluating the veterinary services, and it sets out the criteria to be evaluated. And in the WOA context, such evaluations of the veterinary service are carried out through the WOA PVS, or Performance of Veterinary Service pathway. And adequate human resources, as Simon mentioned, the veterinary workforce, is cited in Chapter 3.2 as an essential element of the veterinary services that requires evaluation and assessment. And as Simon again said, the HR human resource component should include civil service, including public sector staff, as well as private sector staff, and the staff should be comprised of both veterinarians and veterinary paraprofessionals. So there's a recognition by WOA of the importance and role of veterinary paraprofessionals in the National Veterinary Service, and that categories of personnel should be identified and matched to the skills and the tasks that they perform. The code goes on to say in Article 3.2.6, reference to stakeholders, that the competent authority or the veterinary authority should have the authority and capability to develop or engage in public-private partnerships to deliver animal health, animal welfare, or veterinary public health outcomes. And some of you will be familiar with these public-private partnerships through the term sanitary mandate, which is to recruit and hire private sector people to carry out functions on behalf of the government. And this is an important consideration in the context of workforce. Okay, so to summarize, from the WOA perspective on the veterinary workforce, is that it's essential for sufficient numbers of adequately trained personnel for a proper functioning of the National Veterinary Service, and that the workforce encompasses both the public and private sectors, and that the veterinary workforce planning is a necessary process to help ensure that the nation has the right number and mix of veterinary service providers in the right places to reliably provide required veterinary services at acceptable costs. And notably, a broad range of service providers should participate in the veterinary workforce, including veterinarians, VPPs, and even others as necessary and as local conditions dictate, for example, community animal health workers. But nevertheless, no matter who they are, all of them must be properly trained, properly regulated, and supervised, and all must operate within the framework of the law. Okay. So let's look at the PVS pathway and its relation to veterinary workforce. So many of you are familiar with the PVS pathway. It's the flagship capacity building platform for the sustainable improvement of national veterinary services. And it's a voluntary program that members can request to participate in. And the structure and content of the PVS pathway tool, which is shown in the upper right-hand corner here, it really reflects the contents of Chapter 3.2. So all the requirements or criteria for a fully functioning national veterinary service are described in 3.2, and they're turned into assessment criteria through the PVS tool. And the main activity of the PVS pathway, or the key entry point, is the PVS evaluation that a country can request to have a systematic evaluation of their national veterinary service against the PVS tool. With regard to veterinary workforce, PVS pathway originated in 2006 as a voluntary program for members, as I mentioned. And between 2007 and 2009, and I picked 2009 as the cutoff point because that's when WOA held the first global conference on veterinary education. So between 2007 and 2009, 87 PVS evaluation missions were conducted. And at that time, the PVS tool contained 40 critical competencies. The present tool happens to contain 45, but at this time it was 40. And there were two competencies in particular of significant importance around veterinary workforce. And that was critical competency 1.1, A and B, which actually looks at the numbers of veterinary service staff that are available to carry out the functions of the veterinary service, looking both at veterinarians and at veterinary paraprofessionals. Related to that was critical competency 1-2 A and B. And so competency 1 looks at the numbers, and competency 2 looks at the actual competencies of veterinarians and veterinary paraprofessionals. Are they properly trained to do their job? And the results were a little surprising and startling. So when looking at the first 87 missions that were done, in general, when we carry out these assessments, each critical competency can be assessed at 5 levels of advancement. And practically speaking, it's assumed that the way the criteria or levels of advancement are defined, that a level 3 is considered to be adequate. It's not ideal, but it's adequate. And levels of advancement below 3, notably 1 and 2, suggest that really there is an inadequate performance on that criteria within the veterinary service. So it was quite startling to see that almost 50% or almost half of the countries that were evaluated in the 87 had competency scores for their vets that were at a level of advancement or 1 or 2. And similarly, for looking at veterinary paraprofessionals, 48% or almost half of the veterinary paraprofessionals were also at a competency level of training below the level 3 advancement. So this was rather disturbing. And it led to WOA's initiative to develop competency and curricular guidelines for veterinary professionals so that training institutions could look at their curricula and determine whether they were teaching material and content necessary for veterinarians to function effectively in the National Veterinary Service. And these came out in 2012 and 2013. And a few years later, we were able to get funding from the US, the agency DITRA, to do companion volumes for competency and curricular guidelines for veterinary paraprofessionals. And this was achieved, and they were issued the competency guidelines in 2018 and the curricular guidelines in 2019. Okay. Happily, DITRA, the agency DITRA, was pleased with the output, and they approached us and offered to give us additional funding for the purpose of disseminating information and uptake on the competency and curricular guidelines. So we were able to initiate a new project to familiarize partners and stakeholders with the content and application of the guidelines, and at the same time to raise awareness about the roles of veterinary paraprofessionals in veterinary service and the elements that contribute to a suitable enabling environment that allows for the effective utilization of VPPs in the veterinary workforce. And at the same time, through national and sub-regional workshops, to encourage countries to create veterinary paraprofessional enabling environment. Okay, and so let's talk quickly about what do we mean by the enabling environment. And it has three key elements. The first one is, as Simon mentioned, is veterinary legislation to ensure that there's a legal basis, usually through a practice act, to define who is allowed to practice veterinary medicine, what it means to practice veterinary medicine, have a suitable definitions, and also importantly, create a legislative basis for creating a mechanism for regulating the veterinary paraprofession through a veterinary statutory body. So the legislation sets the framework, and then the statutory body has to be developed and animated in order to carry out the regulatory function for regulating vets and VPPs according to accepted standards. And then the third important aspect of the enabling environment is to ensure that the training institutions are delivering a proper curriculum to achieve the competencies that are necessary for the veterinary workforce to carry out their functions. So when a country engages in workforce planning, they should be able to identify the value of integrating VPPs to the workforce, if in fact it's appropriate in their particular country, and then to identify whether there's a supportive legal, regulatory, and training framework in place to achieve the effective integration of veterinary paraprofessionals into the workforce. So question number one, is there a legal basis for VPPs to work in a desired context, for example, private practice, or for example, in food safety, a meat inspection? Question number two, is there a veterinary statutory body to define and regulate the different categories of VPPs that the country feels are appropriate and wants to define? And then are there relationships, supervisory relationships established between vets and VPPs? And are there educational qualifications of different categories clearly defined? And are the training institutions able to deliver the required training to those different categories? Okay.
David, are you almost at the end?
Yeah, close. So then going back to the PBS pathway, WOA offers a number of tools to help support countries in creating that enabling environment. For legislation, we have the Veterinary Legislation Support Program. For regulation, we have twinnings for veterinary statutory bodies. And in the area of education, we have also twinnings for veterinary faculties or veterinary education establishments, and also now curriculum assessment missions for veterinary paraprofessionals. And countries can engage by requesting veterinary identification missions, which assess the overall compliance of the country with the legislative standards in Chapter 3.4 of the WOA Terrestrial Code. And then based on those gaps, if they identify gaps in their legislation and they want to work with WOA to develop new legislation, then they can request a legislative agreement to work on developing new legislation. And Chapter 3.4 covers very numerous aspects of the veterinary domain and provides the legislation standards for each of those aspects of the veterinary domain. And what I've highlighted here is the second bullet is veterinarians and veterinary paraprofessionals. So what are the standards, legal standards that WOA expects a country to have in place to regulate the veterinary and veterinary paraprofessional professions? And with that in mind, what Kelsey did and what she will share with you is she reviewed the practice acts of 50 of the 54 countries in the Africa region to compare the existing legislation against the standards in Chapter 3.4 of the Terrestrial Code, and she will provide her findings to you later in this webinar. So thank you for your attention. And with that in mind, should I just go on to the questions or turn it back